Hello, Facebook friends. It is Carla, your online doctor, with today's Live in 5. Today is Tuesday, November 20th, and it is 5:02 p.m. And it also happens to be my husband's birthday. So happy birthday to my husband, who is not on Facebook. So just putting it out there. I already wished him happy birthday, of course. Anyway, some people ask me why I don't talk for a couple of minutes waiting for people to hop on before I get into the meat of the subject for the day. Hey, Natalie. Hey, Rosemary. Because I want to keep it short and sweet. I want people to know it's like a 5 or 6 minute deal. And Bill's listening. Hey, Bill. I'm going to teach you something today. So I want you guys to know 5 o'clock, by 5:10, I'm done. Okay, so you'll have to watch the replay if you guys come in late. Hey, Marla. Hey, honey, good to see you. Okay, so for the last 3 days, we talked about vitamin D. Okay, vitamin D is so important. Okay, so if you didn't see those 3 videos, go back and watch them because you all need to learn about it. Today, we're going to talk about vitamin C. Okay, also known as ascorbic acid, vitamin C is a water-soluble vitamin, unlike vitamin D, which we talked about was fat-soluble. So vitamin C, hey Margie, is found in many fruits and vegetables. It's much easier to find this in real foods than vitamin D or many other vitamins. We all know fruits and vegetables are just loaded with vitamin C. Hey Mary Lynn. Okay, so what are the benefits of this vitamin? First off, it's an antioxidant, okay? And we've talked about that before. Antioxidants neutralize free radicals and reduce the risk of inflammation. There's that word again, inflammation. And obviously, by reducing inflammation, it reduces your risk of chronic medical diseases, autoimmune diseases, etc., cardiovascular disease, diabetes. The list goes on and on. Okay, number 2, vitamin C enhances iron absorption. So this helps prevent against iron deficiency anemia. A study in the Journal of Clinical Nutrition found taking vitamin C with iron-rich meals increased iron absorption by up to 67%. Okay, keep that in mind if you are taking a supplement. Also, again, never my recommendation. I always prefer real foods, but if you are taking supplements, the same thing will apply. Maybe take the iron and the vitamin C at the same time. Okay, number 3, vitamin C boosts immunity. This is probably the best known, vitamin C is best known for this. Okay, everybody knows if you get a cold, take vitamin C. If you're going on a plane, take vitamin C. If you're doing anything around people who are sick, take extra vitamin C. Okay, studies show getting enough vitamin C helps reduce the symptoms and shortens the duration of an upper respiratory infection. Okay, it also decreases the risk of complications related to that, such as pneumonia. That is awesome. Hey, Christina Marie. Hey, Marty. Who else did I miss? I think that's it. Thank you guys so much for watching today. Today is an important topic. Okay, number 4, vitamin C improves heart health. A review from the National University of Health Sciences, they reviewed 13 studies and it showed supplementing with 500 milligrams of vitamin C daily significantly reduced your LDL cholesterol and your triglycerides. As I talked about before, it also is an antioxidant, so it lowers your inflammation, which is really the true cause of heart disease. Number 5, skin health. Vitamin C is needed to make collagen. That's the protein that makes up your connective tissue, the things that kind of hold you all together. Okay, and it aids in wound healing. So vitamin C is believed to reverse skin aging and protect against skin damage caused by free radical formation from UV light. In people with hyperpigmentation, studies have shown vitamin C may help suppress melanin production to prevent dark spots and dark patches. Also very interesting. Now, this is the one that made me want to even talk about vitamin C, is studies on high-dose vitamin C. And in this case, it is given intravenously. is being used for cancer therapy, mostly by alternative medicine doctors or integrative oncologists. They use it together with chemotherapy to reduce its toxic effects. Now, by high dose, I'm talking 25 to 50 grams. Okay, that's high dose, where most of us would consider taking 500 milligrams a day, upwards of around 1,000 up to 2,000 milligrams. We're talking grams here. Okay, but vitamin C in high doses has also been shown to decrease proliferation of cancer cells and improves overall patient status by boosting their immune system. It decreases their risk of side effects from chemotherapy, and on and on. Now, if you talk to most oncologists, this is what bugged me, they have no problem pumping patients full of poisons such as cisplatin or other chemotherapy agents. And I'm not saying not to take chemotherapy. That is a personal choice if you are in that situation. But they have a hard time thinking of something as simple as vitamin therapy as an option to improve health. Hey, Anita, thanks for watching. Okay, so let's talk about foods, because you know that's what I'm about. If you can get any of your nutrients from real foods, you are better off. So foods are rich in vitamin C. The most common is, or the highest dose, I should say, kiwi. 1 cup of kiwi has 164 milligrams of vitamin C. Raw bell peppers, 1 cup, have 120 milligrams. An orange, well, not one orange, but a cup of orange has 96 milligrams. Strawberries, 1 cup, 90 milligrams. Broccoli, half a cup of cooked broccoli has 50 milligrams of vitamin C. And then Brussels sprouts, a half a cup cooked has almost the same, 48 milligrams of vitamin C. Now, since fruits and vegetables are recommended in daily doses of 5 servings a day, okay, for fruits and vegetables, probably upwards of closer to 8, 9, or 10. If you're getting 50 to 100 milligrams per serving of fruits and vegetables, you're good to go. You are well over your 500, or even if they're getting the low end, where like a cooked broccoli, you're not going to have 10 servings of broccoli, but 10 equivalents would be 500 milligrams. There's your daily dose, okay? Now, again, vitamin C dosage varies by age and gender. Teenagers, boys, 75 milligrams. Girls, a little less at 65 milligrams. And then adults, 90 milligrams for men, 75 for women. Smokers actually need 35 milligrams extra. I wonder why. They're fighting off all those toxins from the cigarettes. That's why. In pregnancy, you need an additional 85 milligrams, and if you're breastfeeding, an additional 120 milligrams. Again, you're eating for 2. So you're providing all of those nutrients to the fetus. Now, supplementation is basically very safe with vitamin C because it is water soluble. 2,000 milligrams per day is the high dose that they recommend. Again, most people recommend 500 milligrams. If you go up towards 2,000 milligrams, you may get a little stomach upset or something. I recommend taking it with food so that it's not sitting in your stomach by itself. Now, vitamin C deficiency is called scurvy, but it's rarely seen in the United States except in people with digestive disorders. And that's because in those digestive disorders, they're getting malabsorption. So they are taking in the nutrients, but the body isn't taking it into the bloodstream and allowing the body to use it. Symptoms of that include fatigue, nosebleeds, easy bruising, bleeding gums, dry scaly skin, dry splitting hair, slow wound healing, etc. So if you have a gastrointestinal disorder that may interfere with your absorption, Crohn's, ulcerative colitis, things like that, you may want to talk to your doctor and just make sure you're getting enough vitamin C actually into your body. They can give it to you intravenously if you're in a flare-up and you're having an issue. So, ladies and gentlemen, this is one that is super easy to get into your diet. You don't even need to ask your doctor to take this one. Most doctors will say, sure, go ahead, take some vitamin C. Okay, make sure you're getting a good source though. If you are not taking it by food and you're taking it in as a supplement, it has to be water soluble. I always tell people, throw your vitamin C into a cup of water. If it doesn't dissolve rapidly, it's probably not getting absorbed in your body. Just a thought. Okay, so anytime you have something that's in a very hard capsule, if it doesn't break apart pretty readily, now I understand your stomach has acid, which is going to help break it down a little bit faster than just water, but it has to get broken down and able to be absorbed. Sometimes people say, that's why I take a chewable. That's what's good for kids. Usually the dose is a little lower, but is another option. Usually tastes pretty yummy too. Some people eat them just as candy. Anyway, that's what I got for you today. We're going to be talking a little bit more about vitamins. Tomorrow we'll be doing another Live in 5. Then we're going to be on vacation until Monday. And everybody can celebrate their Thanksgiving. And we'll be talking, like I said, vitamins for the next week or so. Okay, there's a lot of them to talk about, so let's find out what they're all about. Thank you guys for watching. Give me a thumbs up if you're here. Type in replay if you are watching on the replay so I can thank you for watching. And please, as always, share this video with friends. Copy the link, send it to them in Messenger, post it on your page, however you like. Let's get some natural education going on. Anyway, thank you guys. I will see you again tomorrow for another Live in 5.